Good morning. We just opened up the waiting room and letting people slide in this morning. Then we'll get kicked off here. That's what I'm always saying. Am I on mute? Is my phone off?
All right. Okay, got the sound on.
I was trying to listen to what they were saying.
There we go.
All right. Breakfast, that's a good thing. That background is absolutely gorgeous.
Oh, yeah. Outer Banks, North Carolina.
Yes, I love that. I saw that we were on a call last week, I think. I love that. All right, everybody, good morning. We still have some folks drifting in, but we're going to go ahead and get started because we have a lot of information for you today. My name is Chris Purnell. I'm the program director for Partners in Health and Wholeness with the North Carolina Council of Churches. And believe it or not, I think this might be the first time we have done an event that's just all about PHW. We usually have health topics and lots of great information and speakers, but today this is about the program, and we really appreciate you joining us. So I know there's a lot of familiar faces on here, so some of you could give this presentation, but just to back up a little bit, this program has been a part of the council for 11 years. So we've been around for a long time. We've changed in the last 2 to 3 years. It has really grown. So all the way back to our beginning, our focus areas have been on healthier eating, active living, smoking cessation and prevention, and mental health issues. And really all geared toward, trying to eliminate and reduce the effect of chronic illness in North Carolina and approaching it as a part of our faith. So that's what makes us a little different than a lot of health programs out there. Over the years, especially in the last 3 to 4 years, the program has really grown. We still concentrate on those 4 areas. They will probably always be a focus area for us. But over the last 3 to 4 years, we have really focused on mental health issues around healthier aging, and harm reduction. As most of you probably know, the overdose rates in North Carolina have been for a long time some of the highest in the country. And we have seen significant spikes through COVID. And then last July, we received a grant to work on HIV awareness and testing. So PHW has really grown from 2 staff members 11 years ago till now we have 6, I think. Sometimes I actually forget, and you're going to meet 2 of them that are relatively new with us today. So going to kick it off with one of our newest staff members, Krista. And Krista, I'm going to let you introduce yourself, and you can even share your happy news if you want to, because you shared it with us this morning, and you could share it with our crowd if you would like. So we're going to turn it over to Krista for centering. She is, many of you knew Karen Richardson Dunn. Karen was heading up our Healthy Aging Initiative from Asheville. And Karen had to leave us during the COVID pandemic and deal with some family issues. And you may see her again in the future. She is staying in the field of health and wholeness, but took some time to be with her family. Fortunately for us, Krista had come in to do a practicum with PHW and just so happened to have minored in gerontology. So we talked her into staying with us at least through June. So with that, I'm going to turn it over to Krista to center us this morning. Thanks, Krista.
Thanks, Chris. And you didn't have to talk me into it too hard. This is such a wonderful.
Your smile.
Yeah, no, what a delight. I'm so grateful how that all worked out. But yes, hi, I'm Krista. I'm finishing up my bachelor's degree finally in peace and conflict studies with a minor in gerontology at UNCG, and I'm planning to get my MDiv and have put out applications and starting to hear back, and actually had an interview with Candler and Emory this morning for one of their fellowships. I've been accepted there, and so a lot on the horizon, but so excited to be here with you today in this space. So we're going to do just kind of, I think that's kind of like the broad overview, right, of me. We could talk about me later. I can talk about myself. I've already talked about myself a lot this morning, so we'll just get to everyone else. Kind of a little stuttering prayer as we kind of come into this space together. Lord, as we gather in this space, give us the grace to set down what we're carrying in with us this morning. Whether it's a to-do list longer than the week is, worries about our weekend, worries about family, friends, maybe our own health concerns, unanswered calls, emails we don't know how to respond to, other fears and worries. Lord, give us the grace to set those down and to come into this place with a spirit of curiosity, with hope, and with peace, and gratitude for all that you do and all that you hold for us when we're struggling. Amen.
Amen.
Wonderful. Thank you, Krista. Good morning, everyone, and thank you for joining us. My name is Jessica Stokes, and I do our statewide mental health advocacy efforts, and I'm grateful to see you all and have you join us. I'm going to share my screen. Let's see here. Awesome. Hopefully you all can see that. Everyone can see it. Great. So welcome to PHW 101. We do a lot with our faith communities, and we know it can be a lot to understand, and going through the process of working with us and attaining a mini grant has different steps. And so hopefully we can clarify some of those steps and make this process as easy as possible. So thank you again, Krista, for your centering. To kick us off, it's important to know that Partners in Health and Wholeness is part of the North Carolina Council of Churches. We just celebrated our 85th anniversary as the North Carolina Council of Churches. We were founded in 1935. We are statewide and ecumenical, meaning we work with everybody. In fact, we work with faith communities that are not Christian. And so we work with everyone, we value everyone, and our work is centered on a more just society for all. And we represent over 18 denominations across the state, including over 6,200 congregations. And our areas as the North Carolina Council of Churches include economic justice, human well-being, quality, compassion, and peace for all North Carolinians, following the example and mission of Jesus Christ. So that's the North Carolina Council of Churches, which of course impacts all that we do as Partners in Health and Wholeness. Partners in Health and Wholeness is a program of the North Carolina Council of Churches. And what we do is we work to bridge issues of faith, health, and justice. We think of health as an important part of us. It's a central part of how we live our lives, how we experience the world, how we experience God and each other, and all the parts, seasons of our lives. It's anchored around health and conversations around health. We consider health to be defined by factors that support holistic, physical, mental, social, spiritual, and community well-being. And so Partners in Health and Wholeness, we think of health not only as individual health, but community health. So that also informs the way that we talk about health. We do still and always have believed that faith communities remain a great institution of influence in the community, meaning that we want to empower faith communities and walk alongside faith communities in prioritizing health, because we believe that faith communities can greatly positively help the conversation around health, including access to resources. So we will get into all this, but just as an overview, a preview, if you will, Partners in Health and Wholeness provides resources, connections, and support to faith communities on their various health projects and programs. We aim to establish trust in partnership with faith communities. So we want to work with you. We are totally free to faith communities. We have mini grant opportunities, including an individual mini grant up to 1,000 or a community mini grant up to 5,000, which we'll get into detail later on. We again are statewide. We work in any county in North Carolina. We also recognize and prioritize the inequities in the healthcare system affecting BIPOC communities, so Black, Indigenous, persons of color, communities of color, and people disproportionately impacted by economic inequalities. Chris already mentioned this, but it's always helpful to see it in writing. Our focus areas have always been, as she mentioned, healthy eating, physical activity, mental health, and tobacco and nicotine and vaping education. However, we also have new and deep focus areas on healthy aging, mental health advocacy and education, special projects and denominational support, opioid and overdose crisis and substance use, and now HIV advocacy and education. So we work on all aspects of health, meaning that we can connect you to resources and speakers and programs and trainings on many different areas of health. However, these are our areas that we have really developed deep anchors in. And this is our current staff. And so you can see us all on the screen, and you can email us and call us. We would love to work with you. Chris, myself, Jessica, Krista, Nicole, Brandy, and Elizabeth are here for you. Grateful for you. And you can see all of our bios and names on our website if you want to check that out. Awesome. I'm now going to pass it on to my colleague, Brandy.
All right. Good morning, everyone. Hello, I can't see everyone, but good morning. Okay, so today I'm going to talk about the collaborative pledge and the mini grant and community grant. Oh, Jessica, can you click over? Because I can't click it over from here.
All right, one moment. I'm trying to click over and it won't let me. Okay, did it go? There we go. Thanks,
Okay.
Brandy.
I might have to do like that. All right. Click one more time.
For some reason it's being slow. I'm sorry. I don't know. Let's see here. Okay, there we go. Yeah.
All right. So the collaborative pledge is a commitment to continuing a journey of putting your faith into action. I consider it a community building tool. So this is a document that is submitted once every 12 months so that we can update your information and your progress and update your contact information. And you'll also receive a certificate with this. And we do this every 12 months just because as the world changes, so do ministry needs. So if your faith community decides on another focus, then we're able to update you and then put you in touch with the right people and provide you with the resources that you'll need to do whatever the Lord has given you to do.
Yeah, sorry, Brandon. I'm trying to go through the slides and it's really slow. So there we go.
Okay. All right. So the cycle for the collaborative pledge is from January 15th to November 30th. It's an ongoing submission. So when I talk about mini grants have their own 3 cycles, but for the collaborative, it's continuous throughout, starting January 15th all the way into November 30th. One of the main points is maintaining tobacco-free buildings on worship grounds and touching on any of our focus areas, as Jessica has mentioned earlier, which are tobacco, nicotine, and vaping education, healthy eating, increased physical activity, mental health advocacy and education, healthy aging, and or overdose crises and substance use. Let me just click the next one. Okay, so this is pretty much just a typed walkthrough of how you can get to the collaborative pledge on our site. And on the next slide, you'll be able to see a screenshot of what our site actually looks like.
Yeah, definitely. And I just want to point out that it's important that you won't be able to save and coming back and forth, unfortunately. So just a heads up on that when you do go to apply to sign and join the collaborative pledge and to submit your application, you won't be able to save as you go. So just a heads up on that, and you'll get, yeah.
Yeah, for sure. The recommendation is to just copy the document because it is Google Doc based, and then paste it into a Microsoft Word document and then fill it out on your own time, and then just come back and plug in the answers all at one time, unless you want to do it all together. But if you refresh your page, or if it's idle for too long, then it'll clear your entire progress that you made on it. So if you want to leave and come back to it, then just copy and paste it into a Word document. All right, so here is a screenshot of what the website looks like. You will go to the Programs tab, click Collaborative, and then you will click the PHW Collaborative to get access to the Collaborative Pledge. But there's also a clergy commitment, which we request of all faith leaders to complete, just saying that they are committed to leading the flock in whatever health ministries that your faith community decides on. So both of them have to be submitted. The clergy commitment as well as the collaborative pledge have to be submitted before a mini grant application can be submitted. Okay, so this is just more information on the collaborative pledge. One thing that we ask is that you type out your entire faith community's name. So if you see in the example where it says St. Maria's United Methodist Church, make sure it's all spelled out and not St. Maria's UMC, just because there's a lot of, especially in denominationals, like there's a lot of AMEs, there's a lot of UMC, so it can be difficult if it's not spelled all the way out. So that's just our preference, so that we can make sure that we have the cities and everything correct. So please make sure you do that as well. And we also ask that you include as much detail as possible in your PHW forms, including the 5 W's, which are who, what, when, where, why, and how frequently. Just be as detailed as possible, because we'd rather have too many details than not enough details. All right.
Can you mention the health, who the health lead is too? It was like 3 slides back. Yeah.
Okay, so the health lead is someone within the congregation that pretty much is the point person for collaborative and the mini grant. This person does not have to have a formal health or medical education. It just has to be someone enthusiastic about the work that is committed to being in conversation with the faith leader, and us pretty much acting as a liaison between your faith community and us. So yes, just as long as it's somebody that's enthusiastic, that has the time, and is committed to making sure that they're communicating with the faith leader as well as us to make sure that we can help fulfill whatever faith community need that you have. And again, there's no age limit for it or anything. It's just someone that's willing to do the work. Okay, so the individual mini grant, what it is. Okay, so this grant is up to $1,000. The mini grant must be used to support your faith community's health ministry and its mission. The mini grant should be used for projects that engage the congregants and fulfill a health need in the faith community and in the surrounding community. So a question to consider is, why is your project program the best or most effective approach? 10% of the money awarded may be given to your health lead for them to use toward a part of your project or program. Many grant plans must address one of the PHW's 6 focus areas, as stated earlier: healthy eating, physical activity, tobacco and nicotine and vaping education, mental health advocacy, healthy aging, and or the overdose crises / substance use. All right, eligibility. So your congregation must have submitted a collaborative pledge within the last 12 months prior to applying for a PHW mini grant. Most of the time, faith communities, they'll just submit everything back to back, preferably. As long as it's within a 12-month window, you're fine. So if you were to submit one this month and then apply for a mini grant of March of next year, you will have to resubmit your collaborative pledge because it's outside of the 12 months. So it is crucial you offer as much detail as possible, as I stated earlier, as our mini grants are becoming more competitive. We have also updated what we fund, partially fund, and no longer fund, which is all available on our website.
Awesome. Thanks, Brandy. Really appreciate it. And my apologies again on my computer being so slow. So thanks again for the helpful information. So as Brandy just mentioned, we have updated the list on our website, and it continues to be updated about what we fund and don't fund. This is an overview of the list. You can always reach out to us about specific questions. If you're wondering if we fund this or that, just reach out and ask. We will be happy to guide that. Just as an overview, our grants are for health projects and health ministries. So unfortunately, rent and utilities and salary, we do not fund those things. And you can see the rest of this list. Pamphlets, that has been something that we have really been turning around. We do not do this as often as we did in the past. So please note that moving forward, it's very rare for us to award money towards pamphlets because there's so many wonderful free resources and low cost resources on printed sources. So just reach out to us and we're happy to help you brainstorm. But just a heads up, that is something we are moving away from. How to apply. So let's see here. The best way, as Brandy mentioned, is to enter our community by joining the collaborative pledge. So coming to our webinars, learning about us, getting to know us, and then joining our collaborative pledge. And once you submit your collaborative pledge and your clergy commitment, you will then receive an email from Brandy, our program coordinator, with the mini grant application soon after that, next cycle, I should say. You can always request an application if you haven't gotten it, but we're pretty good about sending out the application once you join our pledge. And we are also requiring a COVID plan if your plans cannot be completed due to restrictions. So heads up on that. When you're applying for the mini grant and brainstorming with your health committee or brainstorming, think about what you can do to pivot in case you can't meet in person. And that's important to include that. The health lead, one note I want to say about the health lead is that some of our churches, the health lead is the pastor, but most of the time it is a dutiful volunteer, as Brandy said, and that's actually really been cool to see folks who are willing to donate their time and their resources and energy to be health leads, because the pastors do so much. So this is a wonderful way to join in the life of this work by being a health lead. And so again, it's not a formal thing, but it's our connection to the church, the health lead being that. And so thanks again, Brandy, for clarifying that. So as mentioned again and again, we can't say it enough, our two standard mini grant opportunities are the mini grant, the individual mini grant for a faith community, and the community mini grant. So again, the individual is up to 1,000. And then the community mini grant is up to 5,000, which is the minimum of 3 congregations working together on a unified goal. So that can be something such as a food pantry, a shared community garden, maybe getting a big training around mental health or suicide prevention and having 3 churches join in and participate. There's endless ways to do a individual mini grant or a community mini grant. And I also want to point out that what we do or do not fund applies to both of these grants. And you can see in this visual right here, the collaborative is rolling through January 15th. through November 30th, meaning that anytime in that window, you can go on our website and join the collaborative pledge. Meanwhile, the mini grant cycle dates are seasonal, February 1st through March 31st, then June 1st through July 31st, and then October 1st through November 30th. So you can do the pledge through most of the year. Meanwhile, you can apply for a mini grant typically once per season. Some ideas, and like I said, there are millions of ways to use this money towards your health projects and health ministries, but here's just a couple of ideas. Health screenings, health fair, host a health fair and invite local vendors and resources to raise awareness. You can host virtual classes and seminars and workshops with a professional speaker, maybe help by curriculum for that, or books for your participants. So you can invite professionals, community gardens, and reaching out to local agencies, mental health trainings. There's all kinds of mental health trainings, thankfully now, that are offered virtual for your staff, for Stephen ministers, for deacons, for anybody on your health committee. And also more ideas around community gardens and tools, all kinds of ideas. And so this is just a very, very, very basic snapshot. We have seen folks do very creative things, and it's been sacred work. How is the community mini grant different than individuals? Some of you have been involved with us for years, and community mini grant is entering, I think it's third year or second year. Sorry if I'm wrong on that. It's relatively new. But the main difference is that the community mini grant must be a minimum of 3 congregations working together. One of the health leads will be the point of contact, meaning the main health lead will be the ones that submit the mini grant application. That's not to say that the folks are not working together. In fact, we assume that they are working together. It's just having that one submission to reflect the entire group's effort is what we need, is one main application to be submitted. We expect the coalition to have already planned and discussed together the course of action for the mini grant prior to submitting, and then a copy of that will be sent to each of the health leads listed. So from all the faith communities represented, we'll have a copy of what was submitted. And then once the health lead has read the copy of submission, each health lead must respond to the email with their agreement statement indicating their understanding of the grant eligibility guidelines and agreeing to the mini grant application. So to sum this up, what this means is that when we send a copy to all the health leads, we need to hear from all the various health faith communities that are represented so that we know everybody's on the same page. So we won't review the application until we hear from all the involved faith communities, so that, again, we just know everybody's on the same page. And I just want to say, this is a lot of information, and we will happily work with you and walk through this very slowly. So just know that. Now, an exciting opportunity. We have our standard mini grants, the individual and community mini grant, but I'm very, very happy and grateful to share that we have a special mental health grant that is reserved for BIPOC communities, so communities of color. This is thanks to the Duke Endowment that we can award faith communities of color a special grant towards mental health projects. This is particularly around mental health as it has been impacted by COVID-19, which that has been almost everything with our mental health, right? So it's truly easy to connect the dots there. But I have to emphasize that the faith community must be predominantly of color, and these grants are bigger. They're $5,000 to $10,000 per grant. And we plan to award 50 throughout the entire state starting this spring. There will later on be 2 to 3 additional large grants up to $50,000 each that are uniquely designed to lay the foundation for a mental health resource hub in Western, Eastern, and Central North Carolina. Our hopes is that it will be an interfaith network with support and resources aimed at the acute nature of mental health needs across the state by region. So to sum this up, special mental health grant, this will continue through May 2023. 50 grants reserved for BIPOC communities, faith communities of color. And this is, let me say, reach out to me specifically, Jessica, at ncchurches.org if you want to learn more, if you want to talk with me about ideas, maybe ways that your faith community would benefit from this, or if you have a friend in another part of the state who might be interested, reach out to me. Please reach out. I would love to talk with you. But this is exciting, and we're grateful to the Duke Endowment for supporting mental health in this way. Some cool resources on our website. Please check out our website. These are just a few examples of what is offered. We have an overdose crisis, Sunday school guide, reimagining health ministries during COVID, so how to keep health ministries engaged. We have toolkits. We have resource guides. You can check out our YouTube page from our website where all of our events, for the most part, I think almost all of them, if not all of them, are there. So if you miss something or you want to reference something, please check it out and join our newsletter. We are intentional about our newsletter. We think about things that we're hearing from pastors and faith leaders and community members about what they're needing and what they're wanting, and we try to highlight that. So join our newsletter. It's a monthly newsletter. We would love to have you read along with us. And then here's just a snapshot of our YouTube page. You can check this out at YouTube, Partners in Health and Wholeness, or go to our website and you'll see a link. You'll be able to really enjoy it. We've done some cool events thanks to some very helpful, wonderful speakers we've had, and it's been great, even virtually during this pandemic. So reach out to Brandy for information on the mini grant and collaborative at phwinfo@ncchurches.org. Our website is healthandwholeness.org. And I'll put it in the chat, just a quick reminder. If you are interested in the special BIPOC health grant, reach out to me, Jessica, at ncchurches.org. And now we will open it up to the rest of our team for questions and answers. And if you have questions, please feel free to put them in the chat or just ask away. And we will do our best to clarify or offer insights that might be helpful. Cool. Thanks, Chris, for putting that in the chat.
Jessica? Just a note I made, and please forgive me, this is still pretty new to us, but one of the other services that we have been offering is denominational support. And Nicole Johnson leads that, and she can talk more about some things we've done, but this is something that's really picking up interest-wise. So Nicole, I'm going to put you on the spot and ask you to just tell a little bit about what we've done and what we offer in that regard.
Okay, so I connect with denominations, specifically like different leaders, depending on how your denomination might be structured. And so sometimes we ask them, like, what are you working on? What do you hope will happen? And how those align with the things that PHW focuses on. And we put together, like, sometimes we've done like a series of webinars. Last year we did with the United Methodist Church, their Western North Carolina conference, specifically a series of webinars on becoming a trauma-informed faith community. So those were designed specifically for them. It was open to other attendees, but it was specifically for clergy leaders and other faith volunteers from those congregations in that particular area. We also have another upcoming one around the overdose, the opioid settlement. And we're going to be doing that with the North Carolina Conference of the United Methodist Church for their clergy leaders and for other faith people who might be interested. We've also partnered with kind of a conglomeration of under-resourced communities around developing a closer relationship between farmers of color in the triad with faith communities who want to connect with those farmers of color and figure out good ways to get support those farmers of color, but also get their produce into areas that where the access may not already be there. So it can look a lot of different ways. Like if you would like to see your denomination, whether it be like your district, whether it be your diocese, if you'd like to see something on a larger scale where, you know, your faith community can be the host, but you'd like to see more of the faith communities in your whatever your smaller geographical areas called, we absolutely will do that. We can design those webinars or workshops or trainings to look however it is that you would like to. We can also talk about ways that a denomination's faith groups can come together and pool their mini grants or come together and do community grants on kind of a larger scale. But at the same time, the impact is very local. So if you want to talk about those things or you'd like to connect me with your denominational leader, please absolutely do that. You can reach out to me as always, Nicole@ncchurches.org. And I'm always excited about pilot projects. Like we're not afraid to try things. Just because things have been done a certain way before around health or it's talked about in certain ways, we are open to hearing ideas that you might have. And sometimes we have funding on our end that we can use to put towards a pilot of something you'd like to try so that it wouldn't be like your individual faith communities mini grant that's been used to pilot the project. Some of that funding tends to be limited, but we are willing to try things because we know that God cares about people. We know that God cares about whole people and whole communities. And so we're very excited about those things. So always reach out to me. And I tend to get excited about things, so I like new projects as well. So if there are pilots you'd like to try, please let me know. Yeah.
And just one other denominational event that we are working on. We are part of the North Carolina Council of Churches. So we have other programs and we have colleagues that work on other issues, and sometimes these collide. We are working with 5 presbyteries to talk about Medicaid expansion and Medicare for all, and just all the things you're hearing swirling around models of healthcare in the United States. What are they? So we have some speakers coming in and are working with 5 presbyteries right now on scheduling that. So any need that you have in your community that is identified, don't hesitate to reach out. It may not be exactly what we do, but we almost for sure will know someone who does. This team sits at many, many tables. These folks are on boards and attending educational events in their respective areas to try to stay up on what's going on out there and the best resources to bring to you. I did get one question I just want to address that kind of ties into this is, do I have to join the collaborative to be part of PHW? No, you don't. We love for you to. And we do ask you to. We are also grant funded. We have 5 funders at this point for different things and different visions that they have. So we have to report back to our funders, just like anybody who gets a grant reports to theirs. So a lot of those things that we fund and we don't fund, a lot of that is driven by our requirements. And being a part of the collaborative just really helps us report to our funders. But even more importantly, it helps us know what's going on out there. I will tell you that prior to COVID, before that word was even in our vocabularies, we had submitted a grant and been approved to do a really deep focus on mental health issues and on healthy aging. And that is because you told us that this was a big issue for you in your communities. And you told us that the stress on caregivers and just all of these issues were things that were holding your communities back from being able to make some of these choices that we all talk about, and are much easier said than done. We heard from you that overdose deaths and substance use disorder was just wreaking havoc on your families and your communities. And we're able to get funding to bring you resources and bring you support. Elizabeth Brewington on our staff is our person who heads up that work and has been physically in almost 30 communities over the last 2 to 3 years, sitting down with you folks and talking about harm reduction and how we can keep our loved ones from dying. So know that you do not have to join. You do have to join the collaborative to receive a mini grant. That is a grant funded requirement on our part. But in order to use our resources, reach out to us, host events, attend events, absolutely not. We welcome you. And so I hope that answers that question, but is there any others that you have?
I'll also add, so all our workshops, trainings, Faith Health Summit that we have every other year, materials maybe that we might mail out. You don't have to join the collaborative to attend those or to participate in those, or even if you'd like to email us and ask about resources or connect you to speakers, or even ask us to come out to your faith community to do talks or different things like that. We will absolutely do those things, even if you don't join the collaborative. So, but to be eligible for the mini grants and the community grants, we do require that faith communities join. On occasion, there might be like a pilot project, again, my pilot projects, a pilot project opportunity that might not require your faith community to complete a collaborative pledge. And we have one of those coming up in the spring. We're talking about doing a series on environment, faith, and health, and that will be connected to like a small mini grant that's $500 towards an environment, faith, and health project. There'll be other requirements like attending webinars on environment, faith, and health. So those come up on occasion, and sometimes those are available, but that's not always regularly. So yeah, I just wanted to add those pieces.
Okay. Thank you. And I see a question for Cassandra in the chat. Question is PHW provide training on how to get a health ministry up and running? Absolutely. That's the basis of what we do. Not only do we help get things established and up and running, we help sustain and strengthen health ministries. So yes, what the best route to get assistance with that is to reach out to phwinfo@ncchurches.org. And what will happen is Brandy will connect you with the best person on the staff, depending on what you're wanting to start. Maybe you want to have a focus area, or if it's just where you are in the state. Some of us are more familiar with certain regional resources, but no matter what, yes, the answer is yes times a million. We would love to help you just get it going and get it started and to brainstorm with you. And if you've had a health ministry for years, we would love to help think about ways of sustaining it, expanding it, and strengthening it. Great question, Cassandra. Thank you. Thanks, Felicia, for your comment. We will make sure you are included on that. And any other questions that I missed? I'm looking at the chat, or any hands in the audience.
I do have one question. If
Yes.
you're part of North Carolina Council of Churches, does it automatically make us part of PHW, or do we have to apply separately for that?
Somebody else? I think I heard my computer kind of had a moment.
Yeah, I can take that if you like. Hi, Elder Cassandra.
Hi.
Hi, yeah, for the mini grants, we do need a collaborative, like joining PHW. That is it, because we are a grant funded program, we have to report that back. In this particular case, it's to the Duke Endowment. So yeah, the answer is both. And I know our executive director has talked about how can we make it easier for folks. So I know that is something that we are talking about is, what does it mean if you're kind of part of the North Carolina Council of Churches? And then how does that work with programs? So it is something we're talking about, but right now we do need that collaborative pledge.
Thank you.
Thank you.
Hey, yeah, thanks again for you all's patience. My internet or something's going on. Y'all know how it is. Year 2 of a pandemic. We all know what it's
And
like.
it's Friday and it's just everything.
Exactly.
Jessica,
But-
my video camera was at 20 till 11 was not working. So
Yeah.
Yeah,
And
I
I do want to, maybe I'll do just a little bit of clarification on joining PHW. Even the staff, we at PHW have struggled with some of that language. So the collaborative pledge it honestly asks questions that focus on your health ministry. We're not asking you to commit to things that are outside of the scope of a faith and health ministry. That is not at all what the collaborative pledge is about. It simply asks questions specifically about like your health ministry, like what are you focusing on? What have you done in the past 12 months? What do you hope to do in the next 12 months? Is this aspect whatever focus of your health ministry is this something new that you've done? Those kinds of questions. And so when you complete that, that is not you like joining a group to commit to things that are outside of the scope of your faith and health ministry. So I just wanted to clarify that. My husband was a pastor for a long time, and I know how that can get kind of tricky and confusing. Like what am I signing up for, and what's my church signing up for? So I just wanted to kind of maybe provide some comfort about completing the collaborative pledge. Yeah.
Yes, and with that, I also want to clarify, thank you, Nicole, that's helpful. Our mini grant is not what a typical grant that you would apply for at a big, a school or some other big program. Our mini grants are meant and designed to be accessible. They are not this big overhaul of all the different materials you may have to supply for other grants. So just know that our mini grants are meant to be accessible. Many people do them within 30 minutes to an hour typically, and we are here to do those with you, to walk you through it. So please know that grants is on another scary word, and we have hopefully eliminated a lot of that with our version of a grant. Just a heads up on that. Thank you, Nicole. Actually, I'm going to pass it back to you. I'm going to screen share again to do the events, but one last call for questions or any comments before I move on. Okay, and please know that we are always here for things that you think of this afternoon or over the weekend. All right, I'm going to share my screen, bring back, and hopefully this isn't as slow.
It's coming. So we are excited about, we've done some of our planning for events that will be coming up later this year. We're going to be having quite a few faith and health connection webinars. We're going to be having sacred conversations throughout the year. There will be at least 2 or 3, or sometimes looking at our calendar yesterday, 4 or 5 in a month. And you'll be able to participate in those. We send those out in the newsletter, and we also send an events update once a month so that you kind of know what's coming up. And February 10th, which is really close, that's in 6 days, we have a faith and health connection on the opioid settlement, and that will be hosted by our Elizabeth Brewington, and she has some speakers lined up, and it's from 11 until 12:30, and they're gonna talk about the background of the opioid settlement, what's the memorandum of agreement, and ways that congregations can get involved in advocating for dollars to be spent on evidence-based practices. There's going to be a lot of money coming into our state, specifically that's going to be focused on evidence-based programs that can support communities that have been very much affected by opioid and substance use.
And I just want to add one tiny thing.
Yes.
it's official that all counties have signed on. So every single county in North Carolina is going to be getting some of this money.
Yeah.
And a lot of our major cities as well. So it's coming.
Yeah. Okay, next one, Jessica. Okay, so I'm very excited about this one. So we have a pilot project called our Environment, Faith, and Health Initiative this spring. And we're going to be doing a series of sacred conversations that specifically talk about faith, health, and the environment. We're hoping to have a cohort of 10 to 15 faith communities that will commit to it, and they'll attend the webinars and try a faith, health, and environment project. We're starting with water because one of the options for this, it's called citizen science, where everyday people get to do science. But for us, it's more than just talking about science. It's going to be looking at the ways we are connected to our environment. You know, we use everyday objects and everyday things in our environment as a part of our religious rituals, like water. And so our first sacred conversations for that one is going to be February 11th. And I'm trying 2 different times because I know some people work and they can't make it during the daytime. And so that will be on February 11th at 11 a.m. and then again at 6 p.m. And the accompanying project for the citizen science portion is going to be that your faith community, individuals from your faith community, get to have their water tested for lead. You'd be surprised about how much there might be lead in water. You don't know what your pipes are or in your communities, and that you'll be able to get them tested at like an official lab, and you'd be able to have those results so that you could get some changes if you need to. So that one's coming up, and I'm very excited about it. And then we have another Faith and Health Connection on HIV advocacy. That'll be February 16th, 11 to 12:30. Again, hosted by our Elizabeth Brewington, and she has some great speakers lined up. And they're going to be telling us about policies that affect people who are living with HIV and how to get involved in advocacy. And I think it's important. I mean, just because somebody's living with HIV, we have to think about the ways that they may be ostracized or not welcomed in communities, and that we advocate for the people that we care about. So we're excited about that one. Another Faith and Health Connection on February 17th, again, 11 a.m. or 6 p.m. And this one will be more focused on like the science of water and less about kind of the religious rituals, but also just the amazingness of something so ordinary. I mean, we drink water, we take showers or baths, we cook with water, and it's there, right? Or for some people, it's not there. And what does it mean when access to water is limited? What does it mean when the water that we assume is safe is not safe? So we're going to be doing that one, and I will be there. I hope to see some of your faces. And another event again in February 24th from 12 to 1. We're partnering with the North Carolina Conference of the United Methodist Church and the Northern Piedmont District of the Western North Carolina United Methodist Church. And we're going to be doing the opioid settlement again, and Elizabeth and I will be kind of hosting that one together. And we're going to be talking about some of the same things that we're talking about on February 10th, except we're going to talk even more about ways that congregations can get involved. So those are our upcoming events. We're very excited about all of them. And I hope everybody gets to participate in all of them if you can. So any questions about those? Okay. Patricia put a comment, and I think that one's going to be, okay. All right, just going to ask real quick. Patricia, can you unmute yourself? I'm trying to see her. We don't, one of them. Nope. Okay. Patricia, we can certainly follow up with you. So it looks like there might be potential for, if it's a partnership with another church, and if you can possibly get a third church involved, we can certainly talk about like a community grant. And if your faith community already has a faith and health ministry, then each of those faith communities, after completing the collaborative pledge, will definitely be able to apply for an individual mini grant, or be eligible for an individual mini grant. So yes, the answer kind of overall is yes. Yeah. Okay. Do we have any other questions or comments?
If we don't have any other questions or comments, we would actually like some feedback from y'all
Mhm.
about what you would like to see going forward and how PHW can help you. So I'm going to launch 2 questions so we can get feedback from everybody. So the first question is, what topics would you like PHW to include in our event planning? And if you have something other than what we have listed here, we would love for you to type it in the chat so we can know and incorporate that into our planning for our year and for our Faith Health Summit that we'll be hosting this fall.
Mm.
All right. Thank y'all so much. I'm gonna end that poll and launch another one. 1 second. All right. And then the second one is asking questions about in-person events in 2022, about people's comfortability around COVID and attending in-person events. So we have a couple different options. So thank you for taking the time to respond to both these polls and give us this wonderful feedback.
Thank you, Elizabeth. And while folks are finishing that, we do have, and thank you for the ones that are added to chat. We will add these and reach back out, maybe to get, flesh out a little bit more of what you're thinking. But there is one question in here. Where is it? Better demographics. I just lost it. About our own communities. Any resources? Yes, we do have resources. And if anyone wants to share those right now, I'm especially thinking about the dashboard on the DHHS site is one, but we can also send resources in a follow-up to this event.
Mm-hmm. There are also localized health county reports that are done.
Yep.
And so we can certainly send that out as a resource. Let's see. Yeah, and there's also in CCare 360, as Jessica put in the chat just now. So, yeah.
And the dashboard that Chris was mentioning, I'll drop a link in the chat, but is specifically around overdose death and harm reduction services in local communities.
Did we miss any questions?
This is Pat McFoy. I'm in Greensboro, North Carolina. I'm sorry, I'm kind of slow this Friday morning. The questionnaire that was on the screen, I didn't realize that we were to click on that and respond now.
Okay.
Is there any way you can put the first 2 back up, or is it too late?
I think we can. Elizabeth, I'm going
I
to
think
defer to
so.
you on that one.
Yes,
Okay.
I just added it back.
Thank you.
Awesome.
Thank you.
And for the one person on the phone, I'm not sure if you're able to see the poll or not. Are we going to send out like a little survey at the end of the resources too? Yeah.
Yes.
Okay, yeah. So if there's somebody on the phone and they're not able to see the polls, we'll be able to send that out too.
Okay, thank you.
All right. That is all I have. So I think, Nicole, it is your turn to close us out.
All right, we are right at 12 noon, a lovely time. So there's been a lot of information here, not super heavy today, but definitely I feel really excited at seeing some new faces and seeing some familiar faces. And this has become a PHW tradition. And we are going to close this out and we are going to do 3 deep breaths. I'll invite you to kind of just settle in the space where you are. I'll invite you you can open your hands, you can leave your hands where they are, you can close your eyes, you can leave your eyes open, either one. And I'll invite you to take 3 deep breaths. I'll count off the first one. If there's something that you're thinking about that's weighing heavily on you, I'll invite you in this moment to just kind of hold it a little more loosely. If there's something like for Krista that's very exciting happening in your life, I invite you to hold it a little more closely and but also a little more loosely. And just kind of be together in this moment, even though it's virtual. It's become very meaningful for us here at PHW. So I'll count off the first deep breath. 1. Blessings to all of you. Thank you for joining us today. We're glad for your feedback. We're going to definitely take those things into consideration. Another PHW tradition. Is everybody able to unmute themselves, Elizabeth? We invite everybody to unmute themselves if they'd like to have some last minute comments, if they'd like to just say goodbye. That would be great. Being virtual gets a little tricky, sometimes we don't always hear everybody's voices. And so we like to give everybody that opportunity. Yeah.
Thank y'all.
Thank y'all for attending. Miss Annie's gone. No, she's still here.
Right here.